Arguing for and against animal testing. Literature review. Animal testing has played a significant function in numerous medical and scientific developments during the 19th century and has continued to assist humans in the discernment of different illnesses. Animal testing was legalized following the thalidomide tragedy which occurred during the late 1950s and early 1960s. Nonetheless, while animal testing is seen to have been of great use to human society in the understanding of illnesses and their corresponding treatments, much debate concerning the topic has sprung up. Those who are supporting the practice reason that medical accomplishments depend on animal use in some manner, whereas those against challenge its necessity. These antagonists present a variety of arguments that it is brutal, unreliable in predicting consequences for humans, poor scientific practice, and that animals have intrinsic rights, and thus not to be used as objects of research. Arguments for animal testing. Those for animal testing have argued that animal research is reasonable as it aids in the discovery of new ways of assisting humans as well as animals in the healing of diseases. The article by Matthews cites that, for success in the area of medicine, animal research is a necessity but only in the absence of other alternatives. He further mentions that animal testing helps in determining whether the medicinal substance under research is harmful to individuals, therefore, ensuring human safety. Through animal testing, human suffering is reduced by the generation of valuable information on how newly discovered drugs respond within a body of a living organism. Wilkinson and Festing are of the view that, without animal testing, the currently used medicaments and procedures would not exist, and the establishment of treatments in time to come would be very limited. Animal testing is used in the trial of several products as face masks, shampoo, wrinkle creams, anesthetics, and new medicinal drugs across the globe. They continue to argue that, as a result of surgery practiced on animals, organ transplants have been made possible. Vaccines for illnesses such as measles, polio, and tuberculosis have also been discovered because of animal testing. Moreover, the discovery of antibiotics, cancer treatment, and HIV drugs have all been due to animal testing. The most evolutionary advancements in reproductive health, like the use of contraceptive methods and family planning, are also attributed to animal testing. Also, testing animals is of use to the cosmetic industry. The industry of cosmetics is about making profits, and thus the use of animal testing in the industry emits economic benefits. First, animal testing helps in the manufacture of products that are not harmful to the skin through testing for toxicity and mutation effects. If the tests show that the product is harmless, then the consumers can buy them, increasing the profits for the industry. Of all the cosmetics, the swine placenta has been regarded as the favorite of the cosmetics industry, not at all because it is inexpensive and easily obtained, but because of its biological likeness to the human placenta as well as its splendid skin healing attributes. Many cosmetic companies have resorted to animal testing. As a result, rendering them capable of maintaining a competitive edge over their competitors as users continue to demand that industries avail safe products. Animal testing is useful in the determination of the harmful effects of a certain product on the environment. Arguments against animal testing. The analysis of Tannenbaum and Rowan literature suggests that animals must be equally and fairly considered. Their arguments are based on moral grounds and the justification of the procedure. They argue that animals have the right to live, using them for experimental purposes is ethically and morally wrong. Making an animal blind just to get a new form of facial makeup is unjustified. What is more, animals and humans react differently to drugs, so the research results might portray inaccurate influences on a human, making it inapplicable. When an animal reacts positively to a drug, it does not necessarily mean that the drug is safe for humans, as the results could be misleading. In reaching this conclusion, they put the following instances into consideration. Parsley is poisonous to parrots while in humans, it is used in flavoring food. Similarly, arsenic is poisonous for human beings while for sheep, it produces no harm. In human beings, morphine acts as an anesthetic, but if given to cats, they produce frantic excitations. Other arguments brought forth include the fact that AIDS research on animals has been ineffective. Animals infected with the disease have not successfully developed the same signs as those of human beings. Over 10 years, more than 100 chimpanzees have been infected with the pandemic, and only 2 have become sick. This indicates the ineffectiveness of using animals to find a treatment for humans. Thus, in the view of those against animal testing, the practice should be prohibited at once.